Thank you very much. Thanks, LSI. Thank you, everyone, for being here today. It's a challenge to finish this week. I guess you're tired. You're flying back in tonight or tomorrow, but I mean, take advantage of the last minutes. It's been a pleasure to be here with you guys and hopefully be here in the future. I'm Josep Sanfeliu. I'm the managing partner and co-founder with my partner Clara, who's here also this afternoon. We are a local VC investing in medtech, digital health, and biotech. We do health tech across the board. We are locals. I've been in the industry for 15 years. My background is pharma, IP, but I was a VC in biotech also for some time, and now we're focusing very much in medtech, diagnostics, and digital health tech in a way. Barcelona is a good place to be. I wanted to describe a little bit what is the potential. So and the idea of this by the sea chat was basically to bring up some of the topics that I'm sure Carlos and Luis will share their views also because of their background and international responsibilities in their companies. But before I jump into some of the data to put some context on what is Barcelona and what is its potential in developing new businesses around here in medtech and digital health, etc. I'm going to pass the mic or the word to my colleagues so they can introduce themselves. We get an idea of who's here in the States now. And then I'll come back to this data, and then we can engage in this conversation. And I'm happy to get your questions and comments also. Thanks.
Yeah, thank you very much, Joe. And again, big congratulations to everyone who's been arranging this week. And I'll send a special thanks to Henry, who's been supporting us a lot in getting the word out about our recent launch. So thank you very much to you and your team. What has just been launched is called We Venture Capital, which is the corporate venture capital arm of Warme, which is one of the large diagnostics companies here in the area. I'll go top down. I'll start with Warme. So Warme is a Catalonia original company owned actually by a family from the start, founded in the 60s. They grew for a very long time through acquisitions and had the philosophy of letting companies grow under their own brand up until 2 years ago when we branded everything under Warme. And by doing so, we were probably the best kept secret in diagnostics. All of a sudden, we were a company of 7,000 employees worldwide and a turnover more than 2 billion that very few heard of because we had operated under different units. We're a specialist IVD company operating in hemostasis, acute care, autoimmunity, and in March we did one of the biggest acquisitions in diagnostics this year by acquiring Immucor, which is an American entity operating in transfusion and transplant, which are very proud to be new business units of ours. And that transaction was about 2 billion. That definitely helps my job. I'm leading the corporate venture capital arm, which is an absolute privilege. I've also had the privilege of setting it up in stealth mode for a year. We have 2 portfolio companies today, a couple of term sheets signed, and we're now officially launched, so we can run under our own flag. We're a small but efficient team, which is absolutely amazing. And we've had the fortune to co-invest with wonderful partners such as Asabys, where we work with the local company. Personally, I am a medical doctor. Since this is a bit of an after-work feeling, I'll tell you my personal story and the way it really happened. VC kind of happened to me. It wasn't my plan. I'm a medical doctor. I meant to be a medical doctor. But when I was going to do my residency in Sweden, where I'm from, there was a budget cut. And since we have very few private hospitals, that meant that everything stopped. So I ended up doing a by design program instead at Karolinska, founded a medtech company, became a medtech CEO, and did the whole journey from a drawing on a piece of paper to an exit process over 7 years. And after that, some people in my surroundings said, look, we've been following you. Do you want to enter into investments? We would love to have you. And that got me into investing. That was 9 years ago. it's the best non-job I've ever had that led me to my favorite job, which is what I'm doing now. So I'm one of those stories that kind of happened. That turned out really well.
Good. Thank you. My name is Carlos Nueno, so I am president for international for Teladoc Health. Teladoc Health is an American company based out of New York. We are leaders in the space of telehealth, virtual care, as well as managing chronic conditions with medical devices as well. I run the international business, which for an American company means everything outside the US, in my case, including Canada as well. And Teladoc took the decision to start here in Barcelona back in 2018 through an acquisition of a company called Advanced Medical, which I was a co-founder in that company. And so that's one of those examples where a company that had grown here from Barcelona that became global was sold to a multinational, in this case in the US, and the international headquarters became located here in Barcelona. So as a company, what we do, three things mainly. Virtual care with patients and connecting patients and doctors. We completed 60 million virtual consultations recently, 21 million last year. So it's grown a lot, especially as you can imagine, over COVID. We do that through primary care physicians. We do mental health. We do specialty care, chronic conditions. Mental health, which is becoming one of the biggest areas of demand of the company. We have a hospital business as well, where we provide telemedicine services for hospitals in the form of both software and hardware. We do things like tele-ICU, where we connect hospitals that have ICU expertise with hospitals, more regional hospitals that don't have those capabilities, and we provide the software and the hardware in the form of devices and robots. We do that in the US with 60% of the hospitals there, but also internationally. We have great partnerships around the world, here in Europe, in Germany, specifically with Charité is a great example. And then we have this chronic care management business, which comes from an acquisition that we did 3 years ago, Livongo. It's a company based out of the US. And that provides a combination of the medical device with sharing the data, and then the virtual care capability so that we can manage the chronic care condition of patients. We do that with 1 million patients in the US, and we are starting to do this international as well. And maybe I'll leave it here because I think, Joe, you have more questions, right?
Yeah, I just wanted, before you guys go shopping or eating, or I don't know what your plans are for the last day in Barcelona, which I'm sure there's lots of things to do. I wanted to bore you a little bit with data, some numbers, because sometimes we are here in Hotel Arts, and you've been here spending these days, and you've seen probably many of the beautiful places in the city. But if you look at the data, recent data published by the Catalan region of the industry healthcare, that comprises close to 1,400 companies. So it's a bunch of companies. Most of them, I would say 400, are registered under the category of biotech. The rest, there's like 120 classical pharma. But then as medtechs, of those 1,400, according to the report this year, 2022, so 23 might be a little bit bigger, medtech companies account for nearly 20% of those, which is close to 250 companies. Digital health companies that are based here account for 212. So sometimes when you put in perspective, you could say that biopharma in the area holds for 400, more or less, companies in Barcelona. And then you have an additional 400 companies that are health tech companies. Digital, some of them are more AI, some more big data, more sensoring technologies. Some of those companies obviously are invested by Asabys, not all of them, just a few, but hopefully the best ones. Then obviously you have the accessory industries, suppliers and everything else. So that gives you an idea. And where is this coming from? Probably from the amount of activity that comes out from, let me give you some data here also again, 20 university hospitals. Vall d'Hebron is well regarded as a hospital for oncology research. Sant Pau is a good hospital also, if you look at their publications and peer-reviewed journal publications. 20 hospitals, 40 research centers. Actually, one of them is just behind that building, the Center for Genomic Regulation, the Hospital del Mar, great places, a place with 500 researchers. 50% of them are international researchers, but you have many other centers, but it's 40 research centers which are around the city. So just a glimpse of the potential exuberance. And when I suggested this title, which is a little bit, let's say, bullish, it's a potential exuberance because you look at the amount of people working in such a small place. We are 1.7 million inhabitants in the city, and you have such an amount of activity going on in healthcare research, clinical research. And then if you look at the research in itself, I was taking a look at clinicaltrials.gov, and you look at the clinical trials done by country. Spain is regarded to be, according to the bulk number in 2022, 1,600 clinical studies conducted in Spain. 75% of them are done in Barcelona, in Catalonia, but mostly Barcelona, of course. So this is, and Spain accounts, and Spain is the fifth country in the world in number of registered trials in front of the FDA. Number one is the US, second is Canada, France, the United Kingdom, and then goes to Spain. 75% of those is actually happening here. If you go to publications, per million of inhabitants, Catalonia is the fifth in Europe after Switzerland, Denmark, Sweden, and Netherlands. And if you look H2020 or European Research Council grants, it's also ranking number 5. The question remains, why is that not transformed so easily? And believe me, we've been in the business of venture and investing in companies and working with the tech transfer offices of the research centers and hospital. Why does that not translate so easily into company building? There's a lot of companies coming from abroad, foreign entrepreneurs that pick up this city to start up companies, but it's not easy to have these companies, the ones that are local. So that was a little bit the debate I wanted to open, because the good is that we have all these capacities and potential and critical mass of research and entrepreneurial activities. We have business schools like IESE, like ESADE, and we have the incumbents, 2 billion size company out of 10 minutes drive from here. You have Almiral, you have Grifols, all these big companies and medtech companies also established in Barcelona, but there's like a lack of connection in the dimension of the amount of companies that are created. If you compare the amount of research and the traction of the industry established, and Teladoc is here in Barcelona. So what is missing in the middle, right, to start up companies and finance them and help the tech transfer? So I just wanted to open the debate with Luis, from your experience in the Nordics, worldwide, in previous jobs, now at Werfen. What do you think it's missing? What do you think is it so good as I just reflected in the data, but what is missing for the next thing to become a success, right? In the middle ground, the scaling up, in the starting up.
Yeah. Well, it's a good question, and I love that you invited me to this topic because it made me having to read up a little bit. Something said there is one new company established or created every week in the life science space here in Catalonia. That's not bad. I think that's pretty impressive. I think Barcelona is also third best startup hub in Europe now, which I'm not very happy about because that used to be Stockholm and Sweden, where I'm from. We've gone down all the way to number 5, and we come from a climate that we think is very innovative and strong, but Barcelona is definitely doing something better. And to be fair, if I try to make the comparison, I think we have more structure up in the Nordics as far as support organizations and accelerators, where we have a different IP setup, where people who work at universities actually own their own IP. It doesn't belong to the university, so we never have to license out. But despite that, Barcelona is beating us, and beating us good by now. There has to be some sort of self-drive in people here, I find, because I think we have some really good efforts here as far as accelerators go and catching of innovation. But we definitely have more of that, or at least a longer history of doing that in Sweden. And still, you're accelerating much more here, or we, I should say, since I'm nowadays an immigrant. I think the most difficult transfer to do is usually from research into companies, right? And I'd love to ask that question back to you, Joe, given that you've been here for longer. What is the piece that is missing from researchers with all these massive centers right here going into the startups where you guys have been investing for years now?
Well, the main disadvantage is that we don't have Spotify that went public. So that was already, put obviously the Nordics in the map, right? That it can happen that from a country that's not the US, you can, go public. I'm just as an idea that one of the things I think it's like there's a lack of somehow a credibility into building companies, although it's not the case. When we invest in companies, we help building those companies. Some of them we're presenting here these days. And of course, Carlos started his own company from Barcelona and succeed. But it's like sometimes tech transfer offices are not easy to deal with. This can be discouraging for some entrepreneurs that, they knock on the door for a license to start up something and it's like, oh no, I mean, are you sure? It's like, I'm not saying this is the response, but my suspicions I don't sleep in the tech transfer offices, so I don't know what's going on inside the door and the attitude, but one reason can be that one. The lack of financing in early stages, probably the ecosystem doesn't provide still that financing. Asabys is trying its best to also invest seed and Series A in some cases, especially if they're close in the area. But I really want to hear, Carlos, and if in the audience you have examples of things that have worked in your countries and how do you, move things from projects and science and the potential into companies that really raise a Series B of $40 million. I mean, happy to hear those comments. But Carlos, what do you think?
Yeah, I think so you're right. I think there's the future looks very bright because of the number of startups that you see now and the finance environment that you see now compared to 20 years when I started. It's completely changed. So I think we have a bright future in that sense. I would say in the past, what's been lacking maybe it's this global mentality. It's just the fact that going abroad as a company and maybe there's a natural tendency to go to Latin America, but really to go to the bigger markets, whether it is the US or whether it is China, and really I think we have the science, we have the research, we have the technical capability, we have the business capability. But in the past, companies have grown to be leaders in the local markets, not so much global leaders. And you need certain mentality to become a global leader. And it's a combination of factors. I think we have them now, but if you are not in the US, you cannot be a global leader. If you are not in China today, you probably cannot be a global leader. And it requires that mentality. And when you see leaders in Europe going global, they are in those markets. They've been bold in taking decisions. But from the US, I'm working for an American company now. And from the US, when you see Europe, not Spain or Barcelona specifically, but Europe, you see a fragmented region. And it's difficult to understand usually. It's a very interesting market, of course, but compared to the size, the scale, and the easy way of doing business in the US, if you have to put $1, you invest that in the US as opposed to in Europe. And so that's something we as Europeans, we need to continue to work to make sure that we make things easier in all senses, from regulations to absolutely everything, just to make sure that the business and the market here is so attractive enough so that companies can grow, become leaders, and also attract investment from other places.
I would like just to share a comment. I think there's many companies that we're presenting at LSI this year, and we see many companies from emerging regions in Europe that have a lot of potential because they have similar potential in terms of research, right? I don't want to say the regions because it would be qualifying or disqualifying them depending on what is emerging, right? But I remember some years ago because the hard time that entrepreneurs have to raise money from emerging areas, that might be, especially in a context where the science is very much distributed in worldwide, in different countries, and they can do great research, but the company is based not in a usual geography for investors to pay attention. It's hard because, entrepreneurs have to overcome that conceptual barrier that region has no potential as a company. And I sometimes it resonates the same way that happens to me when sometimes, and I can mention an anecdote some years ago when I was a VC already, like 10 years ago. We had a portfolio company that was doing great, and I was at one of these JP Morgan meetings, and I was sitting with one of the New York bankers who was there. And I started, pitching the company we had invested. We were like really ambitious. And it's like, what about IPO? And he said, Barcelona company, IPO? But would you invest money in Jamaica? It's like, Jamaica deserves all the respect. But the guy said, it's like, his concept at the time, I'm saying 10 years, 12 years ago, 13 years ago, the hard time entrepreneurs sometimes have to justify the potential because of just a concept of a region. You mentioned Stockholm and now Barcelona is coming up, trying to find its place, but 10, 15 years ago, Barcelona was like a place where we played Olympic Games and we go to the beach and we have great wine. So, but that is changing, but sometimes I understand that companies in scaling up, we have to work against sometimes especially European companies. I think European companies have a hard time. And if you look at the IPOs and access to public market by European companies, they have a hard time. We have the European Euronext, we have the AIM at some point, Swiss WX in Switzerland. It's like a fragmented capital market again, but allowing to go global from a public market perspective, it's beating the concept that you are still in an emerging, ever-promising land of research and potential, right? It cannot be the case. But
well, the size of the population does help. You can definitely start a company here, but it has to go global eventually, especially if you're investing in it and you need a big scale up. And one thing I have paid attention to the last year is that when we go to conferences in Europe with startups, we see very few Spanish companies who go and pitch outside of Spain. So that may be one thing to consider. If you're Swedish like me, there's no point of starting a company only in Sweden because there are 10 million in the population you can scale this for, and then you just have to make it international right away. So when you're investing starting from Sweden, you have to have an international plan pretty much from day one. Spain is much bigger as far as population go, and I don't know if that has been both the benefit and the hindrance in the way that you've been able to establish here and get much farther before you even have to think about what happens when we go new language, new country, across the sea, new regulations, as you mentioned.
Yeah, I think so. And but also, as I said, I think you're starting to see this change and very dynamic environment here. Maybe the other point is, as you mentioned, the stock market, right? I think that drives a lot of the investment decisions. And you're right, here we have a very fragmented stock market in Europe in general. And maybe in Spain, we don't have a renowned stock market either, right? So when you think about Europe, you think about 1, 2, or 3, but we are not in that list. And so if you want to grow, you need a healthy, easy stock market and recognized, especially recognized. The other one would be attracting leaders into Barcelona. We've seen great examples lately and over the last years, multinationals that are investing in the city, that are creating their own hubs in the city. I think once you see leaders in each industry establishing decision points in the city, is when others will invest as well, will create, you'll create more of a competitive landscape as well. You'll bring talent that will allow to take those decisions to a next level. So I think we are seeing all this. We've seen decisions from companies like Glaxo investing in a huge hub here just recently. We took the decision to bring some of our US R&D to Barcelona as well on the data science, for example. So all these, I think, is in the right direction. Still, there are things that we must do. Taxes may be another thing that we could speak about, and certainly regulations. In my world, regulations is everything. We are in healthcare, and most of it healthcare services. And so when you think that, in telemedicine, a doctor here in Spain can e-prescribe, but we cannot deliver the medication to the home of the patient. It's illegal. And you go to London, and this is perfectly fine. You go to Dubai, and you can do that. But you go to France, and there's a completely different regulation. You go to Portugal, is another one. So it's very difficult for a global company in our world to scale in such a complex environment.
Makes sense. I have to ask, though, because one thing I stumbled upon speaking about regulation that was a very positive surprise to me was the concept of entrepreneurship visa. Apparently, you can get a visa if you're an entrepreneur and want to establish yourself in Spain. That's targeted for people. I thought that was brilliant.
I don't exactly know the regulation. I see here, I don't know if there's Barcelona Partners. It's an organization that's helping entrepreneurs and investment come over Barcelona, but they will have probably the information. But yes, there's Kun is there. But I mean, that's right. There's some regimes that have changed in the last years. As you know, there are some tax policies that is precisely attracting. Italy has it for researchers. Here we have it since last year that if you are an entrepreneur, before it was like, and these are tax regimes that I think are available in your countries, especially in Europe, who tries to repatriate talent into your own countries. I'm sure there's examples in the room. In Barcelona, it's basically, it used to be a tax, let's say, alleviation if you were hired as an employee by a company, and typically that was the case in pharma and research because you hired international talent, and that meant a good decrease in the tax. But that was extended because of a law that was changed a year ago, actually by Barcelona Partners and Barcelona Global. I was involved also in that. And it's now decreasing also the tax if you're an entrepreneur that has arrived here and you are not, you're not hired by anyone. It's you that's establishing your business. And you're not actually hired by anyone. You just pick up Barcelona, or you are bringing your own net worth to build a company or to invest in companies right here. So, but this is good, and it's a way to attract talent so they don't get affected by the tax differentiations, which is another fragmentation problem in Europe. But sometimes I feel it's also about mentality and culture, and it was mentioned before. I see entrepreneurs from Israel, just to mention an example, that come over here and they want to, from Israel probably because of their situation, they think globally already because it's obvious that they need to think global, no? And many other regions in the world in which the global reach is a must, right? And probably some of these established, 2,000-year-old cities like Barcelona, probably they've been used to get people visit us, and we're used to that. And hopefully LSI visit us again next year. But but in any case, yeah, I don't think, I don't know if there's more time we still have like some minutes, but I would love to hear if there's people in the audience that want to share the perspectives on what's missing or what's your experience with Barcelona or Spain or in your own countries, things that you have been doing differently that can help us getting more perspective on these topics.
I'll take the opportunity to tell you about two interesting projects that we've seen that may partially answer the question. Because I know in Sweden we had a bit of a fragmented support system, and then AstraZeneca decided not to keep one of their facilities in the very south, which then was transferred from absolute disaster and a lot of people lost their jobs into something called Medicon Village. I'm sure a lot of people you are in the space have heard about it. And in essence, what they did is that instead of having the support system in different units, they just bought the land and not knowing how well it was going to go in the beginning, they put all kinds of life science companies there focusing on SMEs and startups, but also a lot of service providers. And that created like its own landscape of its own. So it was not so much that you had to book meeting, but the right people sort of ran into each other, just going to work and being at work, or just going to the same lunch restaurant. And we're setting up something similar in Gothenburg, where I'm from. Also, AstraZeneca had some extra ground where they set up first a hub where they incubated companies in the life science area, not necessarily to acquire them, but just to provide a space, which has then grown to a whole area where they're building 4,000 square meters now. It's called the GoCo Life Science Village. And more people, and what we see is that people are coming from all over the world to establish in this area, which is not too big, but it's like a couple of blocks of life science only. And I think that just bringing everyone together, kind of like we are now, it sort of makes people interact in a way that is not planned, but still can spin out a lot of positive things.
I think there's a, yeah.
I mean, I'm happy to provide just a comment, not a question, really. I've lived in several different ecosystems within the U.S. I currently live in Boston, but I lived in North Carolina, I've lived in Texas, Ohio, and several other places. But what I want to say is, in order to create an ecosystem that's really sort of that's viable and for long-term viability, you need alignment all the way from top to bottom, which means the government, academia, industry, startups, all of them have to be aligned in wanting to do this and creating the resources that you would need for your startups to flourish. So, I mean, I can give you an example. At least that first million or two that the startups need before the investors like us would come in there, you need to be able to provide that locally, because that's the hardest thing to come by, and that's where you'll have the most impact. And so if you can create sort of resources where you can provide that to them along with some guidance, that really helps your startups, not have to look outside very soon until they're actually ready. And that results in more success and potentially more impact. So that's one thing I would say is a big factor. And I think even though I live in Boston, I would say North Carolina has probably done a much better job of that by providing loans to their startups, et cetera, taking more risk and being willing to take that risk than even Boston has. So that's one, I would say, if you're trying to create an ecosystem that you want to help your startups survive.
On this comment, what is your experience now that you mentioned about the alignment and the government? One of the things I always ask myself, what is your experience with the private initial money? So what's the role of angel investing? Because one of the things in Barcelona is that we don't see those successful companies and entrepreneurs that made it. I don't see them so much going back into new companies. They move away. I'm talking about healthcare and also tech, mostly tech. Tech successful entrepreneurs that move away. They just start a hotel business, or they start real estate, or they move away from their business they know about, right? So what do you think is the role in Boston, in other areas, about the local private business angels and private money in those moments?
I mean, the angels are usually very focused. The life sciences angels focus entirely on your so you've got enough people with money to focus on individual businesses that they don't have to cross-pollinate. So in that case, it's a question of just volume. There's enough there. But the other thing which North Carolina doesn't have, Boston has, is just because of the proximity, because they're so small, Cambridge, Boston, there's a lot more random collisions that happen. And that's another big thing. I mean, if you can create an environment of random collisions happening more often, in a more proactive way, strategically, you're more likely to end up in companies that would engage with each other, which otherwise wouldn't happen. And because North Carolina suffers from that. The Research Triangle Park is well known, but it's so far apart. You have to drive to places to meet somebody. And it's much better when you can just walk and have lunch and run into someone, which is what happens in Cambridge and Boston. And of course, having universities is probably the first thing, because that forces people to come to places because of the good education, which means families are willing to come, which means they're willing to work. So that's why I'm saying it's alignment on all fronts, academia, industry, government. Government has been to be willing to put money into their startups. That first million.
I think, Joe, there's also a point about, this is Carlos, there's also a point about the market size. And if you think about just Spain, from a healthcare point of view, you have like 17 different regions. Even within one region, you have several buyers. So the budget is not centralized at all. And that's pretty common in many European countries. There are exceptions, of course, but so if you think the potential by somehow simplifying the procurement within the public health systems that we have, which I think this is an advantage we have compared to the US. We have a healthcare system that clearly delivers better outcomes. We know that. It's been published at a much more efficiency rate. No, that's a clear advantage. We have an elderly population. Longevity is an issue. So therefore, we will need healthcare forever. Now, buying and having access to the market is super complicated. So if we would be able to somehow find a way to simplify this, immediately will foster innovation, and companies, of course, from around the world, but especially from Europe, would become global players. And that's something, it's depending on us, doesn't depend on other markets, right?
Yeah, hello. I'm from a startup company in Ireland, and I think I would agree with the previous speaker that the first 500,000 that's the hardest part. That's the hardest part to raise. Taking that step from just having an idea to actually having money to put a team together to work on it, and I think government has lined up quite well the different supports. So a lot of the time you'll see a spin out in a university in Ireland, but what will actually have happened there is the founders will have written the grant, spun into the university, and then spun back out again at the end. And it's quite easy to secure a €500,000 research grant within the university. And the TTO office, they understand this. They understand that you're going to try to spin this IP out, and you try to do as best a deal as you can with them on the way out. And you need to make sure you're agreeing. Like, you need to make sure you're agreeing the purchase price of the IP, for example, upfront when you spin out a university. So it's very different. The Swedish example is, I think it's unique, where you own your own IP. So I think getting people to change that model, I think, and there's challenges with that as well, of course, because then I suppose the researcher has a lot of control over that IP, and if they're not all in agreement, that can be a blocking factor. So I think, yeah, that first piece for me is so important, and to have a mechanism where people who don't already have the wealth can actually access it to start a company. I think that's the most important part, I think.
I'll just comment on the IP side, which has been an interesting debate over the years. I think there are to my knowledge, there are three countries in Europe who do it. Sweden, who's been very successful with the model, Israel, who's been very successful with the model, and Italy, who has not stood out despite having the same model. So obviously it takes more components to succeed, but a sense of ownership could definitely be it. The people who stand in the other ring corner, they say, but scientists want to be scientists, then all the innovations just get stuck because there's no one owning and driving it. So I think time will tell what model works better, but it's an interesting debate, and personally find it very interesting to follow. Yeah.
All right. Maybe final remarks, Josep, to summarize. And
well, it's good to be closing today these days at Barcelona. I think that we are aiming to build this industry, at least in Barcelona, stronger. So we join you. Dana Point massively, European companies coming, high emerging companies that have the capacity to raise money, raise the attention of the markets, and more importantly, make their projects go into hospitals and treat patients and take care of us, right? So it's been a pleasure to be here joining you. I'm a local guy, so it's like an honor to have you all guys here. And it's been wonderful. Thank you, Carlos and Luis.
Thank you.
And enjoy the rest of the session.
Thank you very much. What a way to end the day. Thank you for letting us into your home. Thank you.